Alright, so we're trying to look at the next drug, right? Next pharmacology before us. So this is what is known as what the phenacemide pharmacology of phenacemide. So phenacemide actually goes by the popular name known as what phenylacetylurea, or you can just say phenylacetylurea. Anyway, you actually decide to call it. Okay. So for the pharmacology of this phenacemide, we say that it's also known as what phenylacetylurea. So it's actually an anticonvulsant medication. So it was historically used to treat epilepsy. So when you are saying historical, that's to tell you that this drug is basically out of use. But it's always good for you to always know about all the drugs that are existing now and also drugs that have existed before. You get. So we said that it was particularly used in treating epilepsy, mostly when the epilepsy was kind of like resistant to other drugs. You understand? You have tried other drugs and thing has actually failed to respond to it. But it was largely discontinued. Like they stopped using it because what, it was highly toxic. So how does it work? It actually works by inhibiting neuronal sodium channels, which now reduce the neuronal depolarization and what hypersynchronicity is hypersynchronization. Right. So the whole action is what prevents or modifies seizures. So pharmacokinetics is absorption is completely absorbed after oral administration. Metabolism is in the liver to be converted to what p-hydroxylation. Then excretion um, is primarily via the kidneys. Half-life is approximately what 22 to 25 hours. Phenacemide. So clinical use was just basically to treat severe epilepsy. Like I told you guys, mostly epilepsy that has failed to respond to other medication. So particularly mixed forms of partial seizures, psychomotor or temporal lobe seizures. So adverse effect was it was associated with what? It was toxic to the liver, that's hepatotoxicity. It was toxic to the kidneys, that's nephrotoxicity. Then it could cause some abnormalities in the blood, right? Some hematological abnormalities, right? So these were all the factors that actually led to the withdrawal of this drug known as what? Phenacemide, right?